Most of the U.S. Olympic athletes are home now, with the Winter Games having recently wrapped up. And there has been a lot of talk about the pressure these athletes are under and concern for their mental health. Joining us today on Newsmakers is Dr. Kelly Joy, Vice Chair of Osteopathic Manipulative Medicine at KCU Joplin, to talk to us about mental health and depression. Thanks for joining us, Dr. Joy.
Thank you for having me.
You bet. So obviously most of us are not Olympic athletes, and the pressure and stress they're under, it's tremendous. And that's not new. But it has opened the conversation about mental health. So talk about why that's a good thing.
So that's a really good thing, because lots of people suffer from mental health issues that are completely untreated, and nobody pays attention to that. I think that that since we have opened these conversations, people can feel freer to come forward and say, maybe I'm having some trouble, or can I get some help with this issue, instead of it just being swept under the rug.
Yeah. A couple of professional tennis stars, I think her name's Naomi Osaka. She recently was just like opting out of press conferences because she had the anxiety and depression and
stress.
Yeah, and she's just like, I'm not going to fall for that anymore.
Absolutely. I was really impressed with her whenever she came out and said, you know what, these things stress me out, and if they're right before a match, then it really affects my performance.
Yeah.
And I think it's important for people to realize that depression can affect your performance. It can slow you down. It can make you feel like you're not doing well at what you're supposed to do. And when you're a top-level athlete, that's a huge deal.
Yeah. Well, and besides the pressure, from sports, there's also jobs, parenting, all of that, all the pressure to be perfect at what you're doing or the best that you can be. So what are some other reasons or factors that play into somebody experiencing depression? What causes it, if you will?
There's lots of reasons why people are depressed. Some people are genetically predisposed to being depressed, especially with like bipolar depression. 1 in 4 people who have a parent with bipolar depression will have that themselves. So it's very genetically expressed. Other types of depression that aren't bipolar are still genetically predisposing, but not necessarily as tight as that 1 in 4. There are other things that can cause depression, like different kinds of medications and different sometimes hormonal issues, like postpartum depression or things like that. But all depression is a factor of the chemicals in our brain and how available they are to our nerve cells that are interacting with each other.
So when somebody says that, something just like a switch was flipped or something changed, it could be something pretty simple, like you said, medication.
Absolutely. So it could be something simple like medication, or it could be something that is cumulative. I tell patients that, say for example, you lose a family member, and maybe you're doing okay after that, but then maybe you lose your dog, or you have a really bad day at work, and those things can be cumulative. And so the straw that breaks the camel's back can be something that is, I broke my pencil in the sharpener, and that's and then you just can't get back up from that.
Right.
And it seems ridiculous, and I think that's one of the reasons why people don't talk about depression sometimes, is they feel like they should be stronger, they should feel better, or they should be able to deal with whatever that is. And if they're not looking at that cumulative, what's happening in my life, they feel ridiculous whenever they break their pencil, or they leave their cell phone at home, or whatever that thing is. They feel ridiculous, like, why am I so upset over this, when it's really the results of several different things that are happening at the same time.
Yeah, that brings to mind a few years ago, I lost my stepdad, my sister, and my mom.
Oh my goodness.
And then from April to August. And then I got a cold right after my mom died. And then I broke out in this horrible skin thing, like blisters.
Like hives.
Yeah, and it turned out I had acquired sweet syndrome, which is an autoimmune disorder. And they said it was likely triggered by all those events and stress and you not dealing with it. So,
Right.
I mean, it could exhibit itself in many ways.
Absolutely.
And can you talk about like, when would I know I'm depressed or I have depression to where I need help?
Absolutely. So most everybody has down days. They can feel kind of blue one day and then maybe be back up to themselves the next day. The ways that you know that you are having depression, I usually ask patients about 9 different things, and 5 of those 9 things, if 5 of those 9 things is a yes, then that tells me that that's probably some clinical depression that needs to be addressed. So those things are sleep, whether you're getting too much or too little. Interest in the things that you like to do. So are you doing your hobby things? Are you going bowling with your friends? Or are you finding a reason to avoid that all the time? I'm a quilter, so if I find, hey, I'm not quilting as much as usual or that kind of thing. And then guilt. Guilt is kind of a funny thing to say, but people who are having troubles with depression you ask them that question, do you feel guilty about anything? And they'll just open up this can of worms of like, oh, I feel so guilty because my kid didn't have the right shoes for something, or, they ruminate or kind of focus on those feelings of guilt, and they just multiply. The next one is energy, whether or not you have enough energy to do the things that you usually do. People who have depression tend to feel like there's just no energy left. There's nothing in the gas tank to be able to take care of things. The next one is concentration. People with depression tend to have troubles concentrating, and that can be really frustrating and can be disconcerting as well. Appetite is the next one. Sometimes people eat too much in response to depression, and some people just don't have any appetite at all. So it can really go either way as far as that goes. And then the next one's psychomotor, which is the question I usually ask is, does it feel like you're in slow motion and everybody's in normal motion, where they can get their things done, they can do their tasks, they can accomplish, and it just takes so much more effort for you to be able to do that. And then the last one is suicide. So are you thinking about suicide? Are you having active plans of suicide? Or are you just thinking, I think the world would be better off if I wasn't here. So that's the last one. And if you have 5 of those 9 things, then I'm going to be talking about treatment for you for depression. That treatment doesn't have to be medication. Some people are very medication averse. Or they think they're going to be on medication for the rest of their lives because of their depression or that kind of thing. And depression is usually kind of temporal. Some people do have depression that lasts a lifetime, but most people with depression, you have episodes of depression, or you have a certain time when you're depressed, and then you start to feel some better, and you kind of go through a healing phase. So sometimes medicine is really helpful to get through that process, and sometimes you can avoid that pretty easily.
But you should always seek professional help if you even feel, especially the self-harm part, the suicide part.
Absolutely. So if you were asking yourself those same questions and you had 5 out of the 9, it's probably time to talk to some sort of practitioner, whether that be a counselor, or that be a physician, or whatever that looks like for that particular person. You probably should seek help if that's a consistent thing. The thing I didn't say is that those symptoms over the past 2 weeks. So it's not just, oh, today I feel bad like this. It's, hey, have I felt this bad over the past couple weeks?
And some of it's self-reflection, right? You have to think what you're doing and how it's affecting you.
Absolutely.
Because, sleep, which I've noticed recently, probably in the last several years, that, when you fill out the forms at a doctor's office, sleep is always under the mental issue side of it. But I have, insomnia, that it's clinical, trust me. But I don't equate it with being depressed.
Absolutely. Well, the issue with sleep and depression is that if you chronically don't get enough sleep, then you are eating up some of those chemicals that are in your brain, that are trying to help you stay not depressed. And so over time, that lack of sleep can lead to depression. Interestingly enough, lack of sleep has been shown to cause more medical errors. Even for people who aren't saying that they're depressed, just having that lack of sleep can make you make mistakes. And those mistakes can be some of those things that trigger, can be some of those smaller things that trigger a bigger problem of depression.
Yeah. And, thinking about them and seeing the symptoms on paper, I could see how like a woman going through menopause would absolutely feel depressed because all these other things are happening.
Absolutely.
So, I mean, sometimes you go to a doctor and you think they treat you, oh, you're a woman, it just happens, and you feel ignored. But I mean, you have to really be your own advocate with something like this.
That is very true. And what I would say is that sometimes people don't qualify or shouldn't take hormone replacement therapy because of cancer histories or things like that. And sometimes antidepressant medication can be helpful for hot flashes, mood swings, and those kind of things that are associated with menopause.
Oh, yeah, I never even thought that.
Absolutely.
Well, so what can I do for depression, like if I had depression? What are some other things besides medication that can be done?
Absolutely. So there's some small studies that have come out fairly recently that showed that exercise was effective as medication to treat depression, which is a big deal.
Yeah.
The problem is getting people who are depressed to actually get up and start moving and exercising. But that's one of the things that is very effective at changing your mood and helping you feel better. So exercise is huge on that list. And then things like sleep, making sure that you've got good sleep hygiene. Maybe you don't need an antidepressant medicine, but maybe you need some help with sleep. And talking about sleep hygiene with either a sleep doctor or even your primary care physician can be very helpful with that. Also nutrition, because we're talking about chemicals that are in the brain, you have to have the building blocks to make those chemicals. And so if you're consistently eating fast food or, not getting your fruits and vegetables or your turkey, which has, serotonin in it to be your happy food. So if you're not getting plenty of those building blocks, then that can really cause a problem with depression or your ability to get over depression. So those things are big. I was talking with a counselor recently, and he mentioned that whenever he went to a conference recently, that the whole thing was super bright. The whole place had all these lights, and that was because all the vendors that were there were selling lights that would help out with the depression. So I thought that was kind of a funny story, but that is very popular right now because it's the vitamin D that the light helps make really does help with depression. So if you don't get enough vitamin D, then that can cause some problems.
Well, like in one of the types of depression, seasonal affective disorder, SAD, that always happens, or not always, but usually around winter / the holidays. And the sun doesn't shine as much, people are indoors a lot, so phototherapy.
Absolutely, phototherapy. I actually think that is kind of the post-Christmas blues or post-holiday blues, because you don't have the light, you don't have that interaction. You were built up to this, awesome thing at the end of the year, and then all of that's over, and you have this lack of chemical going on that's associated with that. So sometimes phototherapy can be very helpful for that.
Well, and would you advise people, like if they can't get outside, they don't have access, like tanning or just sitting in front of a window just to get the sunlight?
Absolutely. I would say sitting in front of a window. And a lot of the lights that they have that are solar type lights, they have taken out some of our tanning process. Right. So I'm not going to tell you to go out to a tanning bed. Sorry, folks.
The dermatologist would hate us.
Yeah, the dermatologist would definitely slap us for that. So I would almost recommend a light. They can be $25, $30 on Amazon or wherever you decide to purchase that from, and can be really helpful for picking up that mood just a little bit.
Yeah, because holidays aren't always happy. And
that is
everybody
true.
builds them up as such, and if you don't like Christmas, well, then you're a Scrooge. But I'm kind of one of those that I'm not fond of, Thanksgiving and Christmas time anymore. I mean, for my grandkids, I love it, but just that time of year I just don't like it.
It's stressful, and it's interesting because whenever you look at depression, increased stress can increase depression, and people really don't think about that stress of Christmas or stress of Thanksgiving or getting together with relatives that maybe you don't get along with or you don't share political views with or that kind of thing. But that is also stress. I had a patient that came to me one time and she was just feeling terrible, and she's like, I just became a grandma and I have all these cool things that are going on, and why am I feeling so bad? And my answer to her was, having a baby is stress.
Sure.
And her daughter was young and needing a lot of help, and there was a lot of up at nights,
The
and that kind
cumulative
of thing.
effect, like you said.
Absolutely.
Yeah.
And it's like, that's stress too. And she's like, oh, I never thought about that as being stressful. Like, yeah, it's good stress, but it's still very stressful.
Yeah, and stress does cause depression. In external events, life events, like I was telling you earlier, when my son moved out of the house, I was in a funk for however long, and it was in the winter time, and it was raining, and so it was that cumulative effect.
Absolutely. That one thing on top of the other. You may have normal chemicals to start with, and then you lose a little bit because of this happens, and then you lose a little bit. And your body is built to recover from that, but sometimes you get hit again before you're able to recover. And so your chemicals drop a little bit, and then you start to head back up, but then something else happens, and then and then you get down here to the depression. And sometimes one of the things that people get really frustrated with is they start a medication or they start to do something different, and they really want those results tomorrow. And so I will say that it usually takes a good couple weeks of changes before you notice a big change in how you feel. Actually, not even a big change, before you start to turn that ship in a different direction toward how you feel. And it usually takes a month or 6 weeks. So if you start a medication, if you start lights and diet and exercise things to make yourself feel better, give yourself some time. I talked with some family members right before Christmas, and it was about 2 weeks to Christmas, and I said, you know what, things are really seeming down right now. These are the things that I know that we can do. We're not going to do medicine. We're going to do lights and exercise and change our diet and make sure we're getting good sleep and all those things, because I want, when we get to Christmas Day, to start feeling a little bit better. And sure enough, as we got to that, it was like, wow, I don't feel great. I don't feel amazing. I don't feel spectacular. But I feel like I can enjoy my Christmas. Right. And so, like, making those changes before those big events may make a big difference.
And it takes a while for medication to build up in the system too, if that's the route that you have to go.
Absolutely.
And so you have to, wait.
Absolutely. In my practice, I would usually see people back in a couple weeks after they've started the medicine, usually get past some of the side effects and that kind of thing to see if it's an okay medicine for the person. But that's usually whenever they can say, well, maybe I find there's a little bit of improvement. Before that, it's just too soon. You just haven't had a chance to build up enough chemicals to get to where it needs to be.
And so some of the types of different depression, clinical depression, that's when they have to seek medical attention. So
once you get to the point of depression, I would really encourage to follow up with some type of mental health professional or doctor. So that can be your MD or DO, that can be a counselor, that could be a nurse practitioner, a physician's assistant, whatever that person is that you use for a primary care. All of those things are great. If you are doctor afraid or averse, then you can make an appointment directly with a psychologist and start some counseling. Sometimes you know what the issue is and you just need to talk it out. That can be incredibly helpful without ever having to use any medications or the like.
What do you think about talk therapy, like the teledocs or the telemedicine? Does that seem to help?
Absolutely. I think that one thing that the pandemic did for us is it helped us to understand that we are not locked into a doctor's office to provide care. That we can do telehealth or telemedicine with counselors. I had family members that did that over the pandemic, and now that the pandemic has gotten some better, that person's choosing to continue that because they can be in their room when they are spilling out details or things like that. And so it feels much more comfortable for that setting than to go out and sit on somebody's couch or in somebody else's office that's decorated somebody else's way. And it's much more comforting to be in your own setting.
Yeah, and it's a process too. Just because you start therapy and talking doesn't mean that you're not going to have to keep doing it over your lifetime or over a number of months or years, because it's an ongoing process.
Absolutely, especially with things like trauma.
Oh, yeah.
Sometimes you have to re-look at those things several times. Sometimes you think, oh, everything's fine, everything's healed, I'm good. And then a few years later, something else might trigger,
Sure.
and you have to go back and look into those things again. Talk therapy is fantastic for that.
Yeah, I know, working in the media, September 11th, obviously I was not there, but it was hard for me, and is still hard, to see images from September 11th, because I was so immersed in it for so long. And as soon as, September 11th rolls around, I stay off social media, because that's all you see. And, I appreciate the effort by everyone, obviously, but I just can't express it.
Absolutely. And what I will say is that everyone is different. And some people, looking at those videos and remembering helps them deal
Right.
with that. And for other people, looking at
It's
those
triggering.
videos is re-triggering. And even, I really strongly feel that most of our country had a little bit of post-traumatic stress after that, watching over and over and over again those planes hitting the buildings. It was just horrible.
Yeah, and people jumping out of windows, and yeah, that was something that it's still difficult for me.
Absolutely. And so, that would be something I would say, hey, some talk therapy here and there.
Right.
And I'm a big fan of looking at things that may trigger you in your life and starting before that time to
Right.
work through that. So like if September 11th is a trigger for you, going back into late August and saying, okay, I'm going to be extra vigilant about making sure my diet's good. I'm going to make sure I'm getting good sleep. I'm going to make sure I'm exercising regularly. So when this thing that I can't change is coming at me, if you're a student, maybe that's finals.
Sure.
If you're, depends on what that is. If you have a particular death anniversary that hurts or something like that, starting ahead of time. And I had patients that started medicine, like a month ahead of their trigger date, or would start their talk therapy a month ahead of time, and start those things like eating and sleeping and exercising.
Preventive maintenance,
to do that preventive maintenance, so that those chemicals don't get a chance to fall so low that you feel depressed.
Right. That's a great idea. And the part that's hard for me about that day is it's also my husband's birthday.
Oh, no.
So yeah, so it's like, dread, and it's hard to marry the two.
Absolutely.
Well,
Absolutely.
And the other one you were talking about earlier, bipolar depression, that is something that you might not be able to control, whether or not you get it, if it is genetic.
Absolutely.
And when does that normally present in a person?
So usually bipolar depression presents in your late 20s or so. So you may have had some depression in your teenage years or even early 20s, but really that manic issue along with depression is usually a later occurrence.
And how do you know? And I've heard people with bipolar, they're really hard to treat. Because once they get to feeling better, they don't want to take that medicine that makes them feel blah.
Absolutely.
So they self-medicate. And then that turns into other things.
Absolutely. So it's pretty common with depression to have self-medication. So that self-medication can be drugs, it can be alcohol, but the interesting thing is you can also self-medicate with exercise,
Right.
and so that you can have abnormal adaptations to whatever. With people with bipolar, they have both mania, which makes them feel excited and brilliant and great to be alive. Sometimes they'll even hear voices or things like that telling them how amazing they are. Wouldn't you like to have a voice in your head that always tells you how great you are? So they have these periods of up, and then they have these periods of down. Well, if you had a choice, wouldn't you want to be up here all the time?
Sure.
So the medicine tries to keep them someplace in the middle. And so they don't have that big depression or they don't have that big mania. And I can kind of understand, hey, I wouldn't mind a little mania every once in a while. So that can be difficult, and so sometimes, like if they aren't taking medication, if they are manic but can't sleep, then they'll use alcohol or Xanax or things like that to bring them back down a little bit. And then if they're feeling too low, they might use something like some marijuana or something like that, or some speed to make them feel a little bit higher. And so they kind of do this back and forth. And the medicine is built to make that nice even keel. And it's hard to want even keel whenever you can have that up.
Right. Especially once you've experienced it.
Absolutely.
So do people outgrow bipolar? Does it ever go away?
No, it can be controlled, and just like other types of depression, there are behavioral things that you can do that can help that. But lots of bipolar people need medication to help with the control of their disease.
And you teach all of this at KCU Joplin, don't you?
So I teach some of it. Yes, absolutely.
And do you find a lot of students really interested in this side of it, to the behavioral part of it?
Absolutely, absolutely. So I think students are really interested in the idea of sometimes diagnosing themselves.
Right. We all do that. Dr. Google is out there for us.
Absolutely. Or diagnosing family members, or saying, oh, I had no idea I was this way, or I had no idea that, Aunt whoever was that way, or that's why they were that way. So yeah, they're really interested in that process and helping people to get better. When you do interviews at medical school, they all say, oh, I just want to make people feel better. I just want to help people get better. And so that really is a big part of what getting better looks like.
Wow. Well, and another big one is postpartum depression. And that is completely hormonal and I guess biological, chemical.
Absolutely. Yeah, it's a big change in chemicals that are affected by the pregnancy. Like, you're pregnant, you've got all these great chemicals that are supposed to make you feel good, and then you switch over from that to a breastfeeding kind of situation, or a situation where those good feeling chemicals aren't there, and it's very abrupt. And while it's very abrupt, you may not even notice it for a couple weeks, and then it hits. And sometimes it hits even after that first postpartum visit. And so you think that you understand that there is such a thing as postpartum depression, and it's hard to gauge what depression you have. Do you have severe depression? Do you have a very mild case of depression? How do you know sitting at home? It all feels terrible.
And with a baby crying and not sleeping, and you're sleep deprived, and so it's like, and the stigma of being a bad mom.
Absolutely, and asking for help.
Yeah.
And it's like, what? I shouldn't have to ask for help because I should be able to do this myself.
I'm a woman, I should be able to do it all.
Absolutely, but that can be very dangerous.
Yeah.
And I really encourage, well, as a person who used to deliver babies, I always encourage people to call me if they've started to feel down or depressed. And, anytime, day or night, just like they did whenever they thought they may be in labor. And then also, doing checkups and just making sure that, if you're seeing the baby back at a month, or you're seeing them at 2 months and that kind of thing, really makes a difference in just checking up and, hey, Mom, how are you doing?
Right.
I know this is a baby visit, but you're important too.
Yeah, and that matters.
Absolutely.
Thanks so much for joining us today to talk about all this.
Absolutely. It's a pleasure.
I want to thank Dr. Kelly Joy with KCU Joplin for joining us today to talk about depression and mental health. If you or someone you know has suicidal thoughts or thoughts of hurting themselves, call 911 or the Suicide Prevention Line at 800-273-TALK, which is 8255. This is Newsmakers on KGCS TV from the Ruth Copeland Studios here at Missouri Southern State University, and I'm Bobby Potroff. We'll see you again soon.